Portable System for Health Hygiene Monitoring by Calin Ciufudean and Corneliu Buzduga from Ștefan cel Mare University of Suceava, Romania. Few words about this work. For the healthcare, IT is essential because it determines the quality of people's life and because it creates patterns that help organize medical prevention activity. So therefore it determines the quality of medical care and ultimately it determines monitoring in real time of vital parameters as well as of environmental ones. The present work gives us the designs of an automatic health monitoring system capable to sanitize periodically the hands of the wearer. The electronic system developed is a portable one and is fixed on the wrist. Well, such a system has the role of retrieving, analyzing, and transmitting the information taken from the sensors without needing human intervention for any of the system-specific actions. Such portable systems for monitoring the parameters of the human body they are relatively new on the field of applications of electronics and automatic systems. They began to develop greatly since the beginning of 2010 and is constantly developing because these systems enjoy wide popularity, especially among young people. Our system brings two novelties. First, a palm sanitization system using UVC LEDs, ultraviolet radiation type C LEDs, and an alarm system in case the beats per minute of the person wearing the system falls below a prescribed value. An application was created for phones running the Android operating system, which has the role of viewing the data received from a microcontroller, such as number of sanitization made from a total number available for 24 hours. Well, we must mention here that an extensive use of the UVC radiation can damage the human body. So, environmental temperature and humidity, pulse and oxygen saturation level of the person who wears the system as a bracelet are also monitored by our system. Here you can see the block diagram of the hardware support of our system. All the data gathered by the sensors are processed with a microcontroller which are directly sent to the mobile phone and to a web page that memorizes the data and allows remote data viewing. When the data collected by the sensors and processed by the microcontroller exceeds the predetermined limits, the later alarm sound signal for the person wearing the system in the form of a bracelet and also sends a message, SMS, through the phone application to medical rescue services. Few words about the software support of our system. Well, in order to create the system, an application was developed for phones running the Android's operating system that has a role of receiving and sending data from the microcontroller. As well, we created a web page that can be used for remote monitoring and the program that is loaded on the microcontroller. The ASP32TT-Go microcontrollers takes the data from the sensors, displays it on the screen and send it to the phone and to the database. You can see in figure number 2 where the număr curățări disponibile means number of cleaners available and curățări efectuate means cleaning done. A short sequence from our software support. Experimental results. data received from the microcontroller is sent to the database twice per minute through the Wi-Fi protocol. The main element of the web page is a graph that displays the data retrieved from the database. The page is composed of 8 graphics. The first 7 charts show the values that occurred a week ago, and the current day chart shows the current day's values. Also, only the desired values can be viewed on the graph, as displayed here on the figure number 3, where we have the registration of the main parameters within a week. Parameters like body temperature, beats per minute of the heart, temperature expressed in Celsius degrees, and relative humidity in the air. We conclude that this article presents the functioning of the house hygiene monitoring system. The system is composed of a hardware support and a software support. The alarm system sends an SMS through the developed phone application and an acoustic signal through the buzzer when the user's heart rate exceeds a value entered by the user through the application. Sanitizing system uses a set of UVC LEDs. The LEDs are turned on through the application, and the user will have only 14 disinfections per day. The user can also view the data taken from the sensors through the developed phone application, or can view the data taken in a week through the web page. In the future, the web page of our system will be able to develop into a platform intended for a medical institution, so as to allow the registration of more patients simultaneously, of course. Thank you very much for your attention, and waiting for your questions through email address. Thank you.